Excluding skin cancers, colorectal cancer is the third most common cancer diagnosed in the United States. Colorectal cancer is the term used to describe colon cancer and rectal cancer. Because the colon and rectum are located in the lower region of the digestive tract and have similar features, they are often grouped. The colon stores waste and absorbs water and food, while the rectum passes waste from the body. 1. Weight loss. Sudden weight loss is often a symptom of several types of cancer, including colon cancer. Colorectal cancer can lead to unexplained weight loss in a variety of ways. Cancer cells use up a lot of the body's energy supply, and the immune system also uses energy as it works hard to fight the disease. Cancer cells can release substances into the body that change the way food is converted to energy, which can cause weight loss. Additionally, if a tumor in the colon gets large enough, it could block the colon. This blockage can affect a person's bowel habits, which can then lead to unexplained weight loss. 2. Bleeding. Most people don't look at their stools, and so it's important to look. It's important to see what's going on. Probably the most common warning sign is rectal bleeding. There are several possible causes of bleeding from your bottom or blood in your bowel movements. Bright red blood may come from swollen blood vessels or hemorrhoids or piles in your back passage, or polyps known as non-cancerous growths. It may also be caused by bowel cancer. If you notice blood on the toilet paper, in the toilet bowl, or mixed in with your stool, tell your doctor. The blood can be bright red or a darker maroon color. It would generally be more significant bleeding than that caused by hemorrhoids or a cut in the area. 3. Bloating. We all feel bloated now and then, but bloating for more than 2 weeks can be a sign of ovarian cancer, as well as various gastrointestinal cancers. Excessive gas and bloating can be a sign of colon cancer. However, dietary triggers like carbonated beverages, dairy products, high-fiber foods, and digestive disorders such as inflammatory bowel disease are common culprits. If gas and bloating are related to colon cancer, they tend to be late symptoms caused by an obstructing tumor in the colon. Bloating may also occur as a result of cancer spreading to nearby lymph nodes. Talk to a healthcare provider if your bloated belly lasts for more than a week, gets worse, or you have other symptoms of colon cancer. 4. Nausea and vomiting. When nausea and vomiting are symptoms of colon cancer, it's usually because a tumor is causing a bowel obstruction. They can occur if a colon or rectal tumor is obstructing the bowel and inhibiting the passage of liquid or solid waste or gas. Bowel blockage can also be accompanied by painful abdominal cramps, bloating, and constipation. Nausea and vomiting may occur at any stage of colon cancer but are more common with advanced disease. It's important to remember that the occurrence of nausea and vomiting alone, without other colon cancer symptoms, is not likely an indication of cancer. But if you experience persistent nausea, signs of dehydration, or vomiting that lasts for more than 24 hours, seek immediate medical attention. 5. Chronic cough or hoarseness. Not a chronic cough or hoarseness could be a sign of lung cancer. Another common area where metastatic colon cancer may spread is the lungs. Difficulty breathing or shortness of breath, as well as coughing, pain, and fatigue, are possible symptoms when colon cancer has spread to one's lungs. And if you're coughing up blood or also experience chest pain, it is time to seek medical attention. 6. Iron deficiency anemia. Anemia is a blood disorder characterized by a deficiency of red blood cells or hemoglobin. In patients with colon or rectal cancer, intestinal bleeding may cause anemia. Depending on the location of the bleeding within the colon, anemia can be the first sign that blood loss is occurring. People may not be aware that they're losing blood, but a routine blood test will reveal anemia or not having enough healthy red blood cells. Due to microscopic bleeding from a tumor, iron deficiency anemia may occur as the first sign of colon cancer. Common symptoms of anemia include skin pallor paleness, increased heart rate, fatigue, dizziness, and irregular menstruation. 7. Unexplained fatigue. Those occasional feelings of weakness and fatigue happen to us all. Extreme tiredness is a nonspecific symptom, but is very common in people with more advanced cancers, such as stage 4 colon cancer. Cancer fatigue differs from ordinary fatigue in that it's not usually relieved by rest. It's not uncommon for people to have a sense that something is amiss in their bodies, even if they don't have specific symptoms to back up that feeling. But if you're often exhausted, even after resting, it's worth bringing this up to your healthcare provider, as this may be a sign of a health condition, such as colon cancer. 8. Blood in the stool. A warning sign for colon or rectal cancer is blood in the stool. Sometimes you may notice bright red spots, and other times it may not be visible to the naked eye. The severity of symptoms depends on the advancement and location of the disease. You may notice obvious blood in the stool or darker colored bowel movements, which may indicate that there is bleeding within the intestinal tract or rectum, when bleeding is not visible. It is called occult hidden blood and may not be discovered until a blood test indicates a low red blood cell count. If you see any sign of blood in your stool, you should consult your doctor. 9. Narrow stools. Some people with colon cancer may pass more narrow stools than usual. In some instances, this could indicate a blockage within the colon. For example, a tumor in the colon could restrict the space a stool has to pass through. However, narrow stools can occur for various reasons, which are not a sure sign of colon cancer. People with colon cancer often experience bowel movement changes, but no single stool shape indicates this disease. If your stools are regularly much thinner than before, this may suggest a tumor in the colon. Watch for other changes in your bowel habits, like constipation and diarrhea, just to name a few. 10. Bowel obstruction. A bowel obstruction from colon cancer means that the tumor is physically blocking the intestines. Different types of cancer can cause bowel obstructions, including stomach, colorectal, small intestine, uterine, prostate, bladder, and ovarian cancers. Cancers that spread to the abdomen and advanced cancers that press against the colon and small intestine as they grow can also cause bowel obstruction. Depending on the severity of the blockage, solids, liquids, and even gas may be prevented from passing through the colon. This can lead to painful stomach cramps, bloating, constipation, and sometimes nausea and/or vomiting. 11. Jaundice. Another potential complication of colon cancer is jaundice, a condition in which the skin and whites of the eyes take on a yellowish appearance. Here is what happens. When red blood cells break down, bilirubin is formed. Bilirubin is part of the bile fluid produced by the liver. A normal liver metabolizes bilirubin to keep blood levels low. When liver cells are damaged, or when cancer has spread to the liver or bile ducts, the function of the liver is reduced. The bilirubin level in the blood then increases, which causes jaundice. Jaundice may occur when colon cancer spreads to the liver, a common site of metastasis. It may also occur due to pressure from colon cancer on important structures related to the liver. 12. Abdominal discomfort. Abdominal pain or cramping may occur in those who have colon cancer. Colon cancer pain is usually felt in the abdomen, but its exact location can vary. Most people describe it as a dull cramping sensation. Abdominal pain is a late-stage colon cancer symptom. You may feel ongoing pain in your abdominal area and worsening cramps that may not go away after a bowel movement. Severe bloating may accompany pain in your abdomen, as well as pelvic pain. Females can sometimes dismiss symptoms like abdominal discomfort because they can feel similar to menstrual symptoms. It's important to pay attention to your body and how you feel. While these symptoms are also commonly associated with several other causes and conditions, it's vital that you speak to a doctor, especially if symptoms are persistent. If there are other warning signs of colon cancer we skipped out, please let us know in the comments section. If you enjoyed this video, like, share, and subscribe for more videos like this one.